Health Matters with Dr. Mark Castelaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.
Two million people are diagnosed with this disease in the United States. You probably have a family member or a loved one that has this disease. Today on Health Matters, we're going to talk about diabetes. Diabetes is a rampant disease, and today we're going to have medical experts talk to us about the treatment of diabetes. We're going to have patients today that's going to tell us their experiences with diabetes and other experts. So it's going to be a really busy show. Get a pad, get a pencil, be ready to take notes, because we're going to share with you information that could literally save your life. So join us today on Health Matters. This is Dr. Mark Castelaw. Welcome back to Health Matters. Our program today is about diabetes, and our first guest is Mr. Jim Boswell. Mr. Boswell is the CEO of Baptist Medical Group, or BMG as we like to call it. And the first question is, well, what does Mr. Boswell have to do with diabetes? Well, just recently, BMG, through the direction of Mr. Boswell, has partnered with the Endocrine Clinic as part of the outreach to diabetic patients in the Mid-South. Welcome, Mr. Boswell.
Well, thank you, Dr. Castelaw.
Well, tell us about BMG. What's going on with that, and what is, we see BMG everywhere. What does that mean?
We are so excited about BMG. The BMG, Baptist Medical Group, is 3 years young. We started in 2009. We're a group of physicians that came together around common principles of patient care and physician-led, and we have grown to 550 physicians in those 3 years. And we are so blessed to be able to have the Endocrine Clinic recently join us.
Now, how many primary care doctors are part of BMG?
Primary care physicians are close to 200 across the three-state area.
And BMG is expanded into Tennessee and...
In Arkansas.
In Arkansas.
Absolutely. We have physicians, we practice 43 specialties, and we cover all three states where Baptist has hospitals.
Now, that's the primary care. What about the specialists? What are some of the typical specialists that are part of BMG?
Well, we would have cardiology with Stern Cardiology, and we would have internal medicine and pulmonary and critical pulmonary, as well as oncology, as well as several different pediatrics we would have as well. Now,
to the average patient, what is the benefit to the patient to be involved with BMG? I mean, why would I be a patient that would come to a BMG facility?
Well, in so many communities around the country, and as well as in Memphis, healthcare is very fragmented. We have different specialties in different offices, and inside BMG, we are all come together under one roof. Baptist Medical Group. We share a common medical record. The doctors are all partners. So the coordination, for a patient, the coordination and the communication of care leads to better care.
Well, that's being a primary care physician and being part of BMG, which we're very proud of. That has been one of the major benefits that we've seen in our group, the medical group, is that being able to access these other specialists so much easier than we would if we weren't a part of a group like BMG. But what do you see as far as the future of BMG with doctors and acquisitions?
Well, acquisition has continued, and each year we bring on 15 or so different groups. So I don't expect that that'll change in the near future. I do see that as an organization, we are streamlining our processes. We are all come together around a common medical record, as I mentioned. And as healthcare evolves, and more quality focused in terms of and what we call value focused versus volume focused. Our organization and our board and our quality committee is intently focused on driving best practices around all of our organization.
Being an expert as you are in healthcare, everyone is so anxious. The patients are anxious about their health care now with all the changes with the laws, the federal laws and changes. What advice can you give to patients about their health care and seeking insurance products?
Well, first I would tell them, you find a really good primary care physician. And as far as insurance products, there's lots of choices there. Of course, we have in the government under the new Obamacare, we do have a lot of choices with the exchange. My advice is find a product that works for you. Find a product that allows your physician and is in network for your physician and your specialist that you may use, as well as your hospital or your health system. Make sure that you can access all the services that you need. But there are lots of choices there, and we at Baptist Medical Group can help you if you need it.
Now at BMG, whether if we have a particular specialist that's a part of BMG or not, we don't restrict patients where they go. We can help them find a specialist that may not be a part of BMG.
That's correct. We certainly have access to all the specialties, and if it's not in BMG, we can get you into that specialty, as you said. And Memphis is blessed to have pretty much every specialty that is available that you might need as a patient.
Now, is the Endocrine Clinic the first partnered group that specializes in diabetes?
Absolutely. In the Tennessee market, we do have endocrinology in Arkansas, but the size and the scope of service that the Endocrine Clinic provides is absolutely a sort of a charter for us, and they have a long history of providing excellence in endocrinology care and diabetes care. So we're just really blessed to have them.
Well, thank you for being with us today, Mr. Boswell. And this is Dr. Mark Castalon with Health Matters. Stay tuned in because we have a lot more information about diabetes and you'll want to know about it. Thank you for joining us today on Health Matters. I'm Dr. Mark Castalon. Our guest today is Dr. Jay Cohen. Welcome, Dr. Cohen.
Thank you very much.
Dr. Cohen is an endocrinologist with the Endocrine Clinic. He's the medical director, and he is by far one of the most foremost endocrinologists in the Mid-South. Now, Dr. Cohen, our program today obviously is about diabetes. What is the incidence of diabetes in our area?
We have about 8% of our adults have type 2 diabetes, and that's increased by about 50% in the last 10 years.
Do you think that diabetes is underdiagnosed?
Absolutely. Right now, the data seems to show that only about half the people who have diabetes know it. So unless people are coming in for a general physical exam and getting tested or going to a health screen, sometimes they're not aware that some of their maybe being tired or waking up in the middle of the night to go to the restroom to urinate, or some of those things can actually mean that their blood sugar is elevated and they may have diabetes.
Well, you took my next question, because my next question was, tell us some of the typical symptoms that should alert someone that they may have diabetes.
Well, first of all, a lot of times there are no symptoms. So not everything is specific. It could be, I'm dragging around a little bit. I'm a little more exhausted than usual. And there are a lot of things that can cause that, from anemia to, I'm stressed out at work, or my blood sugar is elevated. So seeing your primary care provider is a great idea when you're not feeling right. But other symptoms that we see on a regular basis may include that you're losing weight and it's unexplained, you're going to the restroom and urinating more frequently or more thirsty than usual. A woman may find that she's having some recurrent yeast infections. Those are the types of things that would alert somebody to say, I really ought to see my primary care person.
Now, what are some of the typical diagnostic tests that are done to diagnose somebody with diabetes?
Well, the simplest thing that can be done is just having somebody check their blood glucose level with a finger stick. So just a finger stick glucose If it's over 200 randomly, means you have diabetes. But there's some other tests that we do too. One of them is a test called a hemoglobin A1C. It's a blood test that can tell me what your average blood sugar has been day and night for the last 2 months with one blood test. And then occasionally we will do a glucose tolerance test, which is where you drink a sugar load and we see what your blood sugars do over time. That's kind of not as important a test as it used to be.
Well, take us through a patient that has been diagnosed with diabetes based on one of those tests that you have mentioned. What are the treatment options? And the number one question I always get, am I going to have shots?
Well, that's a good question. Several questions you've asked. I think the first part of it is to say diabetes treatment is not just taking a medicine, whether it be a pill or injections. The key tenets to it is to say we've got to learn how to change your food patterns, what to eat, how much to eat, and how to do that, as well as changing exercise. Exercise is a drug. And, you know, we, as a culture, are watching hours and hours of TV, but we realize that if you eat every day and breathe every day, you're going to have to exercise every day, especially somebody with diabetes, because it really helps dramatically lower their blood sugar, helps their blood pressure, improves their good and bad cholesterol, and really can prevent them from needing multiple medications. So nutrition and exercise are a great tenet as a start, and even if you're on medicines, if you're not doing those two things, there's a lot that we can benefit from you from doing those. Then the third part is stress reduction, because when you're under stress, your blood sugars are higher. And a lot of us can't reduce our stress, but we can learn how to handle stress better or differently. So once we've gone through those things, then we get to medication. And most people with type 2 diabetes will be on one or two or several diabetes pills, because we certainly want to try to not have to use a medicine that's an injectable if we don't have to, and clearly most people don't desire to be on an injection. Right. And so some people will be on one or two medications by mouth, and then occasionally will need an injectable medicine to help to dramatically improve their blood sugars. Sometimes that's insulin, but we have other medicines that can be injectable that can help with weight loss as well as to help improve blood sugars.
Well, we are talking about type 2 diabetes today. There are two types of diabetes, but the main one that we're focusing on today is type 2 diabetes. And Dr. Cohen, so you're saying it's really a multi-pronged approach between nutrition, exercise, and then medication. And then tell us the benefit of lowering blood sugar. Why should we even care? I mean, what benefit do we get by lowering blood sugar?
Well, I think that's a critical question. But before even going there, I think the key is that when you see, or your patient sees you, the goal is let's prevent the diabetes, and then if you have it, let's get rid of it. So it's not always treating a problem, but let's prevent the problem. So if somebody has borderline or abnormal glucose tolerance, or they have been told they have a tendency towards that, how can we make changes to prevent the diabetes? Then at onset, if somebody happens to have diabetes, the key goal is there something I can do to reverse the process, to get rid of this glucose that's high? And the answer is a lot of times yes, but it's going to take, once again, hard work with the exercise and nutrition, not just medication. But now we're at the point where you have diabetes, we're working hard. Why should we improve your blood sugar levels? Well, somebody with diabetes oftentimes has not only elevated glucose levels, but abnormal cholesterol profile. They may or may not have hypertension. They're most likely overweight. So there are a lot of factors you want to work in together. And it takes a team. It takes a team of your primary care physician, specialists, nutritionists, etc. But it also takes awareness of multiple things that we want to work on. And the reason why it's important is because people with diabetes, women, have a 400% increased incidence of heart attack death.
Say that one more time. 400%?
Women with diabetes have a 400% increased risk of diabetes death. Men have a 500% increased risk of heart attack death. And if we can dramatically improve those risk factors, be it glucose levels, make sure your blood pressure is in control, your good and bad cholesterol, lipids in control, etc., we can dramatically decrease the incidence of eye problems, kidney problems, foot problems, as well as heart problems, etc. So we really want to prevent the heart attack, the stroke, the peripheral vascular, leg problems, etc. And working together as a team with primary care physicians as well as the specialists, we feel strongly that we can do that. So we'd rather prevent the problem rather than treat it.
Well, if you have diabetes or think you have diabetes, obviously listening to the numbers that Dr. Cohen just shared with us, there's no question, you better go get checked. Because the sooner you can get checked and the sooner you get your blood sugar under control, the better and lower your risk factors will be for these other conditions. Well, thank you so much for being with us today, Dr. Cohen. And if people wanted to get further information about type 2 diabetes, what would you recommend?
Well, we have the American Diabetes Association.org, as well as you can go on to www.theendocrineclinic.com, where there are a lot of educational resources for patients. There are a lot of really terrific places to learn how to get healthier. There's a great organization called healthymemphis.org for Healthy Memphis Common Table, where the goal is to decrease the incidence of obesity and type 2 diabetes in our community.
Well, thanks again, Dr. Cohen. This is Dr. Mark Castellon with Health Matters. Stay tuned for more information on diabetes. Thank you for joining us today on Health Matters. I'm Dr. Mark Castellon. Our program today is about diabetes, particularly type 2 diabetes. We're fortunate to have two guests that are patients that have diabetes that are willing to share their stories with us, Walter Morris and Larry Robertson. Thank you guys for being here.
Thank you for having me.
Now, Walter, you were diagnosed with diabetes in the past and then sort of fell off the wagon, so to speak, and went to Crystal Hamburgers a lot, but you've sort of gotten back on the path of watching your diet and taking your medicine. So what's your journey been with diabetes?
Well, it's been real difficult for a while, but through medicine and exercising and also diet, you can relieve the problem with diabetes if you work at it.
Now, like you said, it takes work. I mean, diabetes requires effort not only on the doctor's part to prescribe the medicine, but also for patients to take their medicine properly and to exercise and watch their diet. Well, what about your diet today, Walter? You're not doing Crystal Hamburgers anymore. What else are you doing?
If it's green, you can eat it. Just stay away from the carbohydrates, the potatoes, the bread, and just stay on your diet. Check your blood sugar every morning, and you should be all right. And exercise. You can't have one without the other. You must exercise along with your diet.
Well, great advice. Now, Larry, you are diabetic and you were on medicines for a while, but your diabetes progressed and you had to take shots. Tell us about that.
Yeah, you're correct. The shots are not as troublesome as most people would think, sticking a needle in your body. The main thing is just trying to find a spot, that's appropriate to do. But I really didn't I had some anxiety about taking the shots at first, but once the nurses told me how to do it, and it was really simple, and I've become so used to it, it's just normal like breathing. I mean, it's very...
Well, what are some of the things you've done, Larry, to control your blood sugar? Like Walter was talking about diet and exercise. What are some things that you're doing?
Pretty much the same thing, diet, controlling diet, exercise. I've always liked to exercise, and I've probably increased my exercise routine since I was discovered to have diabetes. But I think it's really a matter of disciplining yourself to eat the right foods and to basically exercise properly.
Now, you mentioned this, Walter, already, but how important it is to monitor your blood sugar regularly, because that sort of gives you feedback on if you're doing the right thing or you're not.
Right. If you don't monitor your blood sugar every morning, you don't know where you are. If you don't know where you are, you're not going to know where you're going, and it will just continue to go up. If you don't know in the morning that it's 150 and you have lunch, we're getting off the scale. So you have to do your blood sugar in the morning. I do mine every morning, and then sometimes in the evening, but you have to do that blood sugar to find out where you are.
Now, Larry, with you being on insulin, that's also very important on how you monitor your blood sugar as well.
Correct. Like Walter's analogy, check it every morning. and realizing what I ate the night before, for dinner. And sometimes I'll know whether it's going to be elevated or not based on what I ate. But it's very important to check your blood sugar at least once a day, and I usually check it first thing in the morning.
Now, it's important to tell our viewers that y'all have both been diagnosed with diabetes, but the key thing is both of you are doing real well, correct?
Yeah, I think my A1C has been lowered significantly since over the period of the years, specifically since I started taking insulin.
Walter?
This morning it was 109.
109, I like that.
And you just have to stay on top of it. You just really do.
It takes work.
It does.
Well, thank you guys for being here. This is Dr. Mark Castelaw with Health Matters. Continue to stay tuned because we're going to have more information about diabetes. Thank you for joining us. I'm Dr. Mark Castelaw with Baptist Medical Group. Today on Health Matters, we've talked about diabetes, and now my next guest is Suzanne Gentry. She is a diabetic educator with Baptist Hospital. Thank you for joining us.
You're welcome.
All right, Suzanne, if someone just has been diagnosed with diabetes, they went to see their doctor, they got their lab work, got their hemoglobin A1C, may or may not been prescribed medicine, and now they've been referred to you for education about their diet. What are some of the first things that you talk to them about?
Well, measurable behavioral change is the desired outcome of diabetes education. The American Diabetes Association believes that behavior change can be most effectively achieved by using the AADE-7 self-care behaviors framework. And
well, with diabetes, it's so important that it's a true behavioral change. It's not just something that medicine fix or exercise fix. It's a total behavioral change. And what are some examples of that?
That would be monitoring, taking your medication, exercising, reducing your risk, coping, eating healthy, being active.
You know, patients always ask me, and this is the key question I get from diabetics, what can I eat? How do you walk through with diabetics and tell them exactly what they should and shouldn't eat?
Well, we have a wonderful dietitian that works with our patients. But basically, they are told that most of them think that they come in and they think that they can never eat another carbohydrate the rest of their life. But, that is not true. Basically, you just have to monitor and limit the amount of carbohydrates you take. But carbohydrates are still good for diabetics because when you have diabetes, you've got all your glucose, your blood sugar, everything's floating around in your blood, and normally your insulin breaks down your glucose for energy. Well, diabetics are missing that component, so it's real important that they do take in the right amount of carbohydrates that your body is able to break down, and then your body utilizes those for energy.
Don't you think that it's important for diabetics to take ownership in their disease and for them to be actively involved and be educated about their disease?
Absolutely, absolutely. Education is probably one of the best things that a patient can do for themselves.
So what are some of the things that you educate them about?
Well, we have 3 classes, and we educate on nutrition and exercise, long-term complications, monitoring, medications.
Now, do you see a long-term benefit by patients that have gone through your program and become educated? Do you actually have any kind of outcome data or see any benefit of patients going through your program?
We do. We always get a pre-A1C on everybody, pre-program A1C, and they come in, and that's usually the one that the doctors probably diagnosed them with diabetes on. And then we put them through our program, and then we bring them back in 3 months for a follow-up assessment and encourage them to go back to their doctor first, get another A1C drawn, and then they come back in, bring it to me, and 99.9% of the time we've had a significant drop in their A1C, and they've also dropped weight.
And that, to me, in our practice, that's such an encouraging thing for patients to get that positive feedback that, hey, all this exercise and this special diet that I'm doing, it's paying off by my numbers getting better. And what do you say to encourage that with the patients?
Absolutely, and that is why we try to stick to those, measurable behavioral changes, the 7 ones. We incorporate those in our classes because you have to have behavior change that is measurable, because if you teach them something that's not measurable, then you really don't know what their outcome is and when they've succeeded.
What's a couple other examples of measurable outcomes?
Healthy eating, being active, monitoring, taking your medications.
Well, to me, there's nothing more beneficial to a patient than for them to come in and say, hey, I lost 5 pounds.
Right.
And patients always ask, they say, well, how much weight should I lose? I always tell them lose 1 pound.
Right.
That's all they have to do is lose
Right.
1 pound,
Right.
and then next time lose another pound.
Right.
So try to give them little measurable goals for them to meet so they can get that positive reinforcement, because everybody is so, they're depressed that they have the disease, they feel guilty about it oftentimes, but it's really sometimes not always in their control, but they certainly can benefit by programs like yours on modifying their behavior. In the last minute or so, tell us what patients need to do to get involved in your program.
All we need is your doctor's referral. So that just send us that, and then we contact you and set you up for an assessment visit and then enroll you in our classes.
And I think it's real important for our viewers out there, if you have diabetes, mention that to your doctor, that you would like to see a diabetic educator to learn more about your disease. The doctor may not always have time, or his nurse have time to explain all the nuances of type 2 diabetes, but Ms. Gentry and her organization certainly can. So be sure and remind your doctor, hey, I would like to know more about diabetes, because the more you know about diabetes, the better results that you'll have with type 2 diabetes. Well, thank you, Ms. Gentry.
Thank you.
And I'm Dr. Mark Castellaw. We'll be right back. Thank you for joining us today on Health Matters. I'm Dr. Mark Castellaw. Our program today has been about diabetes. We've had experts on the show, we've had patients on the show that can tell us that diabetes can be treated and treated successfully. Now, coming up, our next program is about primary care medicine and all the changes that are going on with primary care medicine. So stay with us on Health Matters, because your health matters.
WYPL TV 18 presents Health Matters with Dr. Mark Castellaw, sponsored by Baptist Medical Group. BMG is our area's leading multi-specialty physician practice, with more than 500 physicians representing 40 specialties in the Mid-South. They provide a comprehensive range of care for all ages. Whether you need a family doctor, a pediatrician, heart surgeon, or cancer care, BMG gives you access to the most trusted doctors and nurses in our region. More information on Baptist Medical Group can be found online at www.baptistdoctors.org or at 901-227-DOCS to determine the best provider for your healthcare needs. Baptist Medical Group. Get better.
First came the call about loud neighbors. Then a call asking for the score from last night's game. Then a call about being locked out of the house. And finally, the frantic 911 call for emergency help they couldn't get through in time to save John. Save 911 for times when life is on the line. For a list of non-emergency numbers, visit shelbycounty911.org.